How do genetics trigger vasculitis? Imagine your immune system as a highly organized army, trained to defend your body. Sometimes, due to genetic factors, this army gets confused and starts attacking its own blood vessels. That's what happens in rheumatoid arthritis vasculitis, a serious complication where inflammation damages blood vessels outside the joints. Genetics play a key role in this process, especially certain gene variants that influence how your immune system recognizes and responds to self-antigens. Rheumatoid arthritis itself has a strong genetic component, with about 60% heritability. The most important genetic risk factors are found in the human leukocyte antigen region, especially in the HLA-DRB1 gene. Certain alleles, like those encoding the shared epitope, are linked to a higher risk of developing more severe forms of RA, including vasculitis. These shared epitope alleles, such as HLA-DRB1*0401, help the immune system present citrullinated proteins. These are self-proteins that have undergone a chemical change called citrullination. When these altered proteins are presented to immune cells, it can break immune tolerance and trigger an autoimmune response. This autoimmune response can extend beyond the joints and target blood vessels, causing inflammation and damage. The shared epitope promotes high-affinity T-cell responses against self-antigens, which can lead to vascular inflammation. Some alleles like HLA-DRB1041 are associated with an increased risk of vasculitis and related conditions like Felty syndrome. Conversely, other alleles such as HLA-DRB1140 and HLA-DRB1*010 may offer some protection because they bind citrullinated peptides less effectively, reducing the likelihood of T-cell activation against blood vessel tissues. Certain alleles like HLA-DRB5*01 might help protect against severe vasculitis by encouraging regulatory T-cell responses or limiting the activation of pro-inflammatory Th17 cells. These immune cells are often involved in promoting inflammation, so their regulation can help prevent excessive vascular damage. Beyond the HLA region, other genes like HLA-C3, TRAF1, C5, PTPN22, and TNFAP3 also influence the risk and severity of vasculitis by affecting inflammatory pathways and immune responses. Environmental factors, such as smoking, can interact with these genetic predispositions, further increasing the risk of developing RA and vasculitis. This complex interplay highlights how genetics set the stage, but external factors can influence the outcome. Understanding these genetic factors helps doctors identify patients who might be at higher risk for vasculitis. For example, if someone has the HLA-DRB1 shared epitope alleles, they may need closer monitoring for blood vessel inflammation. This knowledge also supports the development of targeted therapies that modulate immune responses based on genetic profiles. In summary, genetics trigger rheumatoid arthritis vasculitis mainly through specific HLA-DRB1 alleles that encode the shared epitope. These alleles promote autoimmune T-cell responses against citrullinated self-antigens in blood vessels, leading to inflammation and damage. Protective genetic variants and other immune-related genes can influence this risk, making the genetic landscape quite complex. Recognizing these factors helps in managing and preventing severe complications, but always remember that individual experiences can vary. If you have concerns about your genetic risk, consult with a healthcare professional for personalized advice.